Good day, my name is student Ms. Stevens, and today we're going to be going through the process of administering iron medication. So the first thing we need to do when administering any medication is to go through the doctor's plan as well as a drug chart to look at the medication due. So for Mrs. Kent, we see that the doctor ordered Petidine 50 milligrams IM with Gravol 25 milligrams IM every 6 hours, or PRN, which is as needed. So now that we saw what was due, we are going to the patient and we are going to introduce ourselves and explain that medication is due, explain what the medications are and the risks, and gain consent to do it. Hi, good day. My name is student Ms. Stevens. Can you tell me your name? Hi, Martha. Can I just see your hand 1 second? Okay. So the doctor has said I'm going to give you some Petidine and Gravol. Do you know what that is? So have you ever taken it before? Okay. So Petidine is an opioid. It is used to relieve pain, right? And when taking Petidine, they could get some side effects such as dizziness and vomiting and drowsiness, right? And nausea. So he also said they come and give you Gravol with it, so it could kind of lessen the symptoms of vomiting and nausea, right? It's an intramuscular injection, so it's going to be given in the muscle, and where I'm going to be giving you is in the thigh. Right. Is that okay with you? Okay, no problem. Thank you. Now that we have gained consent from our patient, we are going to gather our equipment needed as well as make the necessary checks. So for administering iron medication, we need a syringe. I'm using a 3 ml syringe, and we need to check the expiry date and make sure that it is not open already. We need our needle. We have a 23 gauge needle here. Alcohol prep pads and our medications. When getting our medications, we need to check the expiry date. So this has not expired yet. This is our Gravol, and there are no impurities in the bottle, observed in the bottle. And for our Petidine, the same thing, we need to check our expiry date, which has not expired yet, as well as make sure the bottle hasn't been opened and no impurities in the bottle. So now that I washed my hands, I'm going to calculate how much medication I'm going to be putting up. In this bottle of Petidine, there are 2 mils or 100 milligrams. The doctor ordered 50, so therefore half of 100 is 50. So that will be 1 mil we're going to pull up from the Petidine. We're also going to check the expiry date again and check if it's broken, any impurities. Same thing with the Gravol. The doctor ordered 25 milligrams of Gravol, so that will be equivalent to 0.5 mils. So that's how much we're going to be pulling up. Also check the expiry date again, has not been expired, as well as any impurities. Okay. Alright, so I'm opening. You also want to make sure you have a sharp spin and use the alcohol prep pad to wipe. One swipe, the top of the bottle. We are going to pull up the gravel first, as it is used by everyone, and to prevent contamination we are going to pull it up first. So you withdraw the amount you are going to pull up. So we said 0.5 mils. So we're going to inject 0.5 mils of air into the bottle. Turn the bottle and draw up 0.5 mils. Cap back. So we've drawn up our gravel. Now we are going to open our petadine, and we are using a gauze to crack the bottle. Make sure you put it in the sharps bin. I'm going to move on it and draw up 1 mil of petadine, because 1 mil is equivalent to 50 milligrams, which is what the doctor prescribed. So that will be equivalent to 1.5 mils. A little more. And then using the scoop method, cap back our needle, and this is our one point five mils of petadine and gravel. Discard. So we place our syringe in the basket, as well as our alcohol prep pad. And now we're going to wash our hands again, and then put on a pair of gloves and go and administer the medication to the patient. So before we go to the patient's bedside, we want to check again the doctor's notes to make sure we have pulled up the right medication. So we're checking again that the doctor wanted us to give petadine 50 milligrams IM with gravel 25 milligrams IM every 6 hours or as needed. So we pulled up, so we said that 50 milligrams is equal to 1 ml of petadine, and 25 milligrams is equal to 0.5 mils of gravel. So that will equate to 1.5, which we have here. Hi, Mrs. Kent. I come to give you the injection. Are you ready? Okay, nice. Are you comfortable? Okay. So with me, I have my gloves on. For administering, I do not need sterile gloves, but for the demonstration, this is all I have right now. I have my tray with my medication as well as my alcohol prep pad. I also have the doctor's orders here on the drug chart. Okay, so just a little overview of where I'm going to inject and how I found that area. You want to locate the vastus lateralis muscle in the thigh, right, in the thigh. So you're going to find it. It should start 1 hand width from under the groin and should end 1 hand width above the knee. You want to then divide that muscle into 3 parts and then in half, and the ideal place for the injection would be the outer middle area. Okay, so I'm going to clean the area. 1 swipe, throw away, and I'm going to get the medication. And I'm going to inject it in at a 90-degree angle. I have to spread the skin and inject. Make sure not to cut back. Mrs. Kent, how are you feeling? Okay. So if you feel any symptoms, just let us know and we'll come and see about you, right? And thank you very much. Okay, so after you administer your medication, you want to go ahead and discard of your sharps in the sharps bin as well as discard of your gloves and perform hand hygiene again. You'd want to sign in the drug chart the medication you gave and the time, as well as document in your nurse's notes the medication you gave, the amount, the route, and the time you gave it. You'd also want to go ahead and observe Mrs. Kent for any adverse effects that she may experience, and if she does, you want to perform the necessary care. Thank you for watching my video, and I hope it was very informative.